The information shared on Light Body Radio is for educational and informational purposes only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician, licensed healthcare provider, or qualified wellness practitioner with any questions you may have regarding a medical condition or health goal. Dr. Lara May, her guests, and affiliates do not claim to cure, prevent, or treat any condition and are not responsible for any actions taken based on the information shared in this podcast. By listening to this podcast, you acknowledge that you are responsible for your own health decisions and that any actions you take based on the content are at your own discretion and risk. Thank you for tuning in to Light Body Radio.
Welcome to Light Body Radio, where science meets soul and healing gets multidimensional. I am your host, Dr. Lara May, functional medicine pharmacist, master intuitive Reiki channel, and certified life and health coach. Here we decode root causes, transmute stuck energy, and empower your full spectrum healing journey, body, mind, and light body. This isn't just wellness, it's awakening, grounded in science, guided by spirit, and designed for your evolution. Let's rise and radiate. Welcome to the next level of you. Hello and welcome to Light Body Radio. I am your host, Dr. Lara May, and today we have with us Dr. Brett Cordes, and he was your typical overachieving, people-pleasing medical student, then surgical resident, and then very successful clinical practitioner in Texas. And he went on, I would say, like a journey that's probably not as unique as we think it might be, unfortunately. And so he went on a journey of self-discovery, of addiction with opiates, and really that turned into a self-discovery mission. And so without further ado, I'm going to let him tell you his story, and welcome.
Well, thank you. Thanks for having me. I'm very happy to be here.
So tell us sort of how everything unfolded for you. I don't think a lot of people out there realize that physicians also can struggle with, addiction and recovery. And I think it's something that definitely needs to have more light shed on it.
Yeah, for sure. And I'm gonna, if you don't mind, I'll start kind of at the beginning of my story,
Sure.
which is in childhood, because a lot of the decisions that I made and actions that I took make more sense within the context of how I was raised and whatnot. But anyway, for the most part, I was raised in a normal, quote unquote, normal family. I was born and raised in Baton Rouge, Louisiana. My dad was a professor of mathematics at Louisiana State University, LSU, and my mom was an English instructor also at LSU. So academics was very heavily preached and prioritized in the household. I do have one sister. She's 10 years older than I am, and she was salutatorian of her high school. She was number one in her law school class. So you get the idea. Even by the time I was 8 years old, when my sister was graduating high school and moving states to go to college, really nothing less than the best or anything less than excellence, I thought was acceptable. And I really started to kind of match or gain my own self-worth from any sort of achievements that I had or accolades that I would earn or that of boys or things like that. And, the funny thing is, no one ever told me that was the case. They would praise me. I would get praised when I did something well. If I did something poorly, I would, it was a learning opportunity, but it's not like I had to go, sit in a cage for an hour. So it wasn't my parents telling me, hey, our love is conditional. And it really wasn't. It was my own misinterpretation of things that led to that. I do want to stress that because I think, my parents were and are wonderful and have been supportive throughout this entire journey. But needless to say, that continued into adulthood, where my self-worth, not necessarily my self-confidence, but my self-worth was tied to my achievements. So anyway, I played basketball and ran track in high school, went to LSU, and really had no idea what I wanted to do in college. I mean, no idea whatsoever. There were no healthcare practitioners in our family, no doctors, nurses, physical therapists, nothing like that. Our family was mostly academicians, and we had some attorneys, but nobody in the medical field. So I majored in history just because I liked history, and I thought that was cool, but I had no idea what I wanted to do until it was the last week of freshman year at LSU. I was taking exams, and I was diagnosed with non-Hodgkin's lymphoma, which is cancer of the lymph nodes. And this is going to be my first, kind of major fatal disease that I unfortunately have faced in my life. The second one being addiction. But this cancer battle, I could speak for hours just on it, but I'll say it lasted 16 months because there was one recurrence. The cancer recurred after the first line of treatment. But I traveled to Texas, to MD Anderson in the Texas Medical Center to receive a stem cell transplant, which in 1997 was experimental. I mean, people weren't getting stem cell transplants way back then. So my cohort, my clinical trial cohort was 10 patients, and only 2 of us survived. So, out of that journey or battle, if you will, although there were several silver linings that I took out of it, I did have a pretty healthy case of survivor's guilt that I would have to deal with forever. But very, very small price to pay, in my opinion, for making it through that. But this is what made me want to go to medical school and become a physician. My experience with cancer from the patient standpoint, and being able to kind of sit back and objectively not judge, but assess, what doctors did well, what doctors didn't do well, bedside manner, all that kind of stuff. So I didn't change my major, actually. I just started taking all the appropriate prerequisite classes and graduated college, and then went to medical school in New Orleans, also at LSU, and then matched in ear, nose, and throat surgery, head and neck surgery at Baylor in Houston, Texas, which ironically was where I was treated for cancer just 5 or 6 years prior to that. So residency, for those who aren't familiar with surgical residency, it's pretty intense. It's 5 years for ENT, but I enjoyed it. I kind of thrived in that competitive type environment, again, because there were lots of areas for me to achieve, lots of accolades to gain and awards and stuff like that. And that was my bread and butter. That's where my self-worth came from. So I did very well in residency and graduated and joined a private practice within the Texas Medical Center in 2009. So, gosh, I was 32 years old before I really had my first job, before I had my first real paycheck, other than cutting grass and landscaping when I was younger. But when I started working in 2009, it was just phenomenal. It was absolutely everything I had made it out to be. I did not stay in academic medicine because, quite frankly, I was getting burned out on that competitive environment. I was getting burned out on doing things just for the sake of doing them so that they would look good, as opposed to doing things that I enjoyed. So I did not like doing research, and I didn't want to do that for the rest of my life. So I made the decision to go into private practice instead of academics. And I would say the first 5 years of my practice, I'm not a real big fan of this term, but I was living the dream. It really was everything I had ever dreamed it would be. My wife and I had two healthy children. We lived in the suburbs south of Houston, and life was good. Life was excellent. Everything was falling into place. And I could not have asked for a better setup. And so everyone's kind of waiting for the crash here. And what had happened sometime around 2014 or 15, which is about 5 years after I was practicing, I felt like I was starting to get kind of bored. And at the time, I thought this was boredom. In retrospect, and after a lot of counseling, I learned that really what I was experiencing was a lack of fulfillment. But at the time, I thought that I was getting bored at work. And that was really my very first symptom of burnout. And this was despite my surgical practice partners telling and begging me throughout those 5 years to take more time off, to take vacations, to take a day and a half of off of work every week. I was working too much. I was hearing that from my partners. So the blame, so to speak, I mean, I hold all of the accountability in my workaholicism, if you will. But needless to say, this boredom kind of started to turn into anxiety and then a little bit of depression. And I'll back up here for just a second because this is important. My first exposure to opiates was when I was fighting cancer back in 1996 and 1997. And, lymphoma for me was not a painful cancer, but I had several minor surgical procedures which required pain medication. And I remember very distinctly that when I would take a pain pill at that time, it felt good. It wasn't. It was nice. I liked it. I wrote a memoir of my experience, and I remember writing that it felt like a 2 to 3 beer buzz. But there was no earth-shattering euphoria. It was nothing to write home about, and it never once occurred to me to take a pain pill to get high or to feel that feeling. And when the pain medication was out, that was it. It never occurred to me to take it to get high, which is interesting considering what happened when I took it in 2015. And so it was a Friday afternoon. Everything was going fine. My usual routine on Fridays I would get off work early around 2, go home, and my wife and I would hang out by the pool, and I would crack open a couple of Bud Light limes and drink some beers, and we'd talk about the week and the upcoming weekend and whatnot. Well, what happened on this particular Friday afternoon was that a drug rep had come by and given me some samples of a hydrocodone-based cough medicine. Hydrocodone is the medication in opiates and painkillers for listeners that don't know. And so I immediately thought, oh, I know what this feels like. This will be like a nice 2 or 3 beer buzz. I'm going to take one of these home with me, and I'm going to try one of these instead of my 2 beers. And that's exactly what I did, except that this time it was, and it's really not possible for me to describe adequately, but it was an unbelievable, earth-shattering, life-changing euphoria I had never even come close to feeling. It was nothing at all like what I remembered it being. And so, needless to say, that decision to sip on that cough medicine that one Friday afternoon eventually led to a 5-year, gradually descending, full-blown addiction to prescription opiates.
Wow. And, again, like before we went live with this, I asked if it was okay for you to tell your story, because I do think it's interesting to hear that perspective of like, it wasn't anything, like earth-shatteringly bad that sort of put you on this trajectory, which, for those, I'm sure a lot of listeners out there on their own journey could definitely relate to that. So in what ways was your personal and professional life affected? Like, did you find relief from this burnout with this new habit that you had?
Yeah, that's a great question. And the answer is yes. It was a perfect and complete answer to all of my problems, basically at that time. And this is almost certainly why I became addicted to opiates, but with my genetics, opiates made me feel euphoric. They gave me energy. They increased my focus. They increased my motivation. They increased my stamina. And I was the happiest I've ever been, all rolled into one. So I felt, and I really, truly felt that I was a better doctor, that I was a better husband. I was a better baseball coach. I was a better father when I was high on opiates than when I wasn't. And I truly believe that, which is part of the mental gymnastics that took place, that I had to execute to justify taking drugs as a practicing physician and surgeon. But yes, opiates for me started out as a solution, as a great solution to life's problems. It relieved the burnout. It relieved some anxiety that I was having, just normal life parenting anxiety that we all deal with. It relieved that anxiety quite a bit. So it was a great solution until it wasn't, until, they gradually segued from being a great solution to being a horrible, horrible problem.
And did you find that it perpetuated or alleviated maybe the tendency that a lot of healthcare practitioners have to be in that constant achieving mode? I'm really curious about that.
Did the opiates?
Yeah. Did you find that it sort of like curved that, and so you were more present, like you were able to take that time off, you were able to be more present with your family, or was it you're motivated to keep achieving, and sort of continue down that workaholic path too?
Yeah, my boy, I never thought of that. That's a good question. I would have to say that it perpetuated it because I wanted to be the best. Because the opiates kind of hit my motivation. It increased my motivation. It increased my motivation to want to be the best. But that's also true in coaching my son's baseball team. And that's also true in, trying to be a good husband. I wanted to be the best at everything I was doing. But to your point, my work took priority over really everything. That's certainly where my time went.
So at what point was the straw that broke the camel's back that you realized something's got to give, like this can't perpetuate and go on this way?
Yeah, I've thought about this a lot, and there's been a couple of times, but the first time that I realized that, okay, I have a problem here was when my family, we went on vacation to Mexico. We went on I think it was a 5-day vacation. And at this time I was using opiates maybe 3 or 4 times a week. I wasn't using them every day. My opiate use was a very, very, very slow progression. So from that time I took that cough medicine sample to when I was having to take opiates around the clock to avoid burnout, that took 2 years. So the first time that I knew I had a problem, I was probably a year in, maybe a little more, somewhere around 2015. My wife and my kids and I went on vacation, and I had some pretty bad withdrawal symptoms 24 hours in. And I didn't even tie those symptoms to opiate withdrawal. I was using them 3 or 4 times a week. And it wasn't until I got back that I realized, oh my gosh, I've been in withdrawal the last 4 days. I just thought I had a mild flu or something like that. But when I realized that, it was pretty obvious that I was a drug addict and that I was suffering withdrawal symptoms and tolerance and and everything else that goes to define addiction. I was there.
Well, I think that's the other thing too. I mean, we hear all the time, at least, I don't know, maybe I do because I'm in, the Western medicine world still, but it, when we hear about these drugs, we hear like the hydrocodone or the Norco is so hard to get off of, the oxycodone, like that they're so habit forming. Like, yes, they serve a purpose to alleviate acute pain, but they're so habit forming that even what would seem like a benign frequency, like 3 times a week, can still throw you into those withdrawal symptoms. Which I don't think a lot of people realize either. I think even though we talk about how addictive and habit forming they are, I think there also comes this assumption that, oh, well, you must be having to use them every day to have a physical addiction. And that's just not true. I mean, a dependence. How about, I'll say a physical dependence. So like that's when your body is obviously depending on a certain amount of the drug to prevent from going through withdrawal, right?
Yeah, and I certainly wasn't in full-blown opiate withdrawal on this trip, but I was having a bad time sleeping. I was very anxious. I was having a little bit of cold sweating at night and some restless legs at night. So those were my main symptoms.
Okay. All right. Well, and then so you came home and you decided to continue down the path or to get some help, or how did that unfold?
Yeah, no. So it's interesting how this worked out, but on the flight back home, I was really starting to feel the withdrawal, and it dawned on me at that time, this is opiate withdrawal. And so when we got home, I went straight to my office to get some more cough medicine samples to relieve this. And then shortly thereafter, I was using them every day. So by 2015, certainly by 2016, I was using opiates every day, or else I would experience withdrawals.
Did your wife notice or tell there was something different about you?
So she began to start noticing a change possibly somewhere in 2017.
Okay.
We went on another vacation to California, and I took some medicine with me to help prevent the withdrawals, and I ran out. And this time I did have full-blown withdrawal while on vacation. Tried to hide it, but that's when she started to suspect something was going on.
Yeah. I think this is so helpful and interesting. So I really appreciate your honesty and your vulnerability here. So I want to like sort of move into like the burnout piece of it too. Because I think, obviously I think burnout came to the forefront during the COVID pandemic, especially in the medical field. Just because that was the field I was in. So that's where I saw it the most. I saw colleagues, actually start taking mental health leave. If I was lucky enough to work for a company that actually provided that. Or like actually finally start taking all that vacation time that they were accruing, because there is this culture of, there's the lip service that, yes, you have the vacation. Yes, we want you to take it. Yes, we value, meaning like the company values our practitioners' mental health. But then, when it comes down to, actually sort of putting their money where their mouth is, it sort of seems like there's some double standard there, or, like they're not exactly ready to like back up the full implications of what this would actually mean if they lived what they preach, so to speak. So what have you seen? And because I know you work with a lot of healthcare practitioners with their burnout too. So I'd like to move into that a little bit.
Sure. Well, I mean, I will second what you were just talking about. And we were talking about this a little bit before we started recording, but yeah, I have definitely noticed that businesses and bosses and institutions, it's very easy to advocate for the mental health well-being of your employees. But it just seems that when it actually comes time for an employee to prioritize their mental health and take a day off, take a Friday off, it's that's not well received a lot of times, because it directly affects the bottom line. And when it directly affects the bottom line, I think some of these employers, they lose some of the excitement that they had for mental health awareness. And then COVID, you can just multiply that times infinity almost, because, healthcare already, we have a shortage of doctors and nurses, and everyone knows that during COVID, that deficiency was amplified and felt all over the world. And so there weren't a lot of mental health days that were being given out during the COVID pandemic. That's for sure. And actually, I did not have the opportunity to work during the COVID pandemic because in 2019, I was fired from my job because of the addiction. And so I was out of work between 2019 and 2023. So I was isolated at home with everyone else during that time.
So did you go into a program for your recovery, or how did that work, especially in light of the shutdowns in the middle of all that? That must have been super challenging.
Yes. So everyday use was going pretty hard, probably around early 2017. And my addiction was discovered in 2019 by my partners. And I was terminated from my job immediately after they found out. In fact, they called me into the office on a Friday afternoon, said that they had gotten word, or they had found out, that I was using opiates regularly, and to go home and then take a week or a couple weeks and let the dust settle, and they were going to investigate this and that, and they'd let me know. And I got a termination in the mail, a termination letter in the mail, about 8 or 9 days after that. And that was the last I ever saw or talked to my partners, even today, even still to today. So I did not go to rehab immediately. This was in 2019. I did go to a 90-day inpatient rehabilitation facility in July of 2020. And so I went voluntarily, but I also knew that was going to be mandated by the Texas Medical Board. Any doctor or nurse or anyone in the healthcare field that needs to be treated for addiction has to go for a full 90-day residential program. But I will say, I loved my experience in rehab. It was not fun by any means, but it was really unbelievable how much I learned about myself. And in learning about myself, I learned why I do some of the things I do, and why some of the poor decisions that I made throughout my life, why I did that. It was just very helpful to learn about myself, centered around the effort of recovery, right? I was not wasn't doing opiates now. So if you're not going to do your drug of choice, you need to replace that drug of choice with some healthy coping mechanisms and stress management habits and whatnot. And so, 90 days, I was back home and on the road to recovery. This was right in the middle of COVID. This was in September of 2020.
And when you came back into the world from rehab, was it a hard adjustment, or did you sort of know right away that your calling was to then help other medical practitioners that have been on a similar path?
Yeah, no, I had, at this time, I was not thinking about coaching. I came back to, it was a little bit tempered, because you're right, rehab is a bubble away from life's problems. There's no question about it. And it really helped a little bit, because when I came back to the isolation and the quarantining that, COVID was causing. And so I was isolated at home, but so was everyone else. So that was the reality. And no, from the second I got home, I was doing everything in my power to get back to work as soon as possible. And the plan was for me, they suspended my medical license, and the plan was for it to be suspended for 1 year, in which time I would be drug tested, randomly and check in once a day. There was a monitoring program and contract that I had to enter for 5 years. I was also going to AA meetings and doing what I needed to do per the rehab institution that I went to. So I was doing what I needed to do to get better, and also jumping through any hoops that were placed in front of me to get my medical license back.
Mm-hmm.
Unfortunately, that 1 year suspension on my license turned to 2.5 years, mostly because of just inefficiencies that the pandemic caused. But that was extremely frustrating. And me being out of work, recovery is very difficult. There's no doubt about it. But the lack of fulfillment that I was experiencing not working was at least as bad. It was brutal on me mentally to watch my colleagues fighting in this COVID pandemic and me just sitting on the sidelines watching it unfold. That was very, very difficult for me. So I was counting the days till I got to go back to work. And so I did end up going back to work in 2023. We had since moved from Texas to Louisiana. I got a Louisiana medical license. I had a couple of probationary aspects to it, but I went back to work in 2023. I signed a 1 year contract with a group. And it only took me about 3 or 4 weeks to realize that my passion for clinical medicine had faded quite a bit, which was surprising to me. I thought I would go back to work and everything would be fixed. I would get my fulfillment back. Everything would be fixed. There was some, rocky years with the marriage that would get better, and everything would get better. And I just lost my passion for it. I loved my patients. I absolutely love my patients. I love the relationships that I forged with my patients, but the doctoring part, so to speak, surgery, it wasn't what I remembered it to be. And so I had to make a career pivot. And right around this time, a previous colleague of mine mentioned life coaching to me. And I looked into it and realized that, wow, I can possibly be a physician coach to other doctors who are experiencing burnout, with or without substance abuse, because I've lived it at this point. And it was terrible and horrible. And I would love to be able to, even if I could just help a little bit, ease that situation for other colleagues, that could be a new calling. And so I turned all my attention toward that. And that's where the coaching came from.
Yeah, actually, I'm on your website, which is theburnoutdoc.com. And I want to just read some of the stats that you have on here, because I think it's really powerful. So 53% of physicians report being burnt out as a whole. Am I reading that one correctly?
Yes.
Yeah. Yeah. And then 23% of physicians who report being depressed. 46% of male physicians report being burnt out, and 63% of female physicians report being burnt out. And that's just, I think it speaks, a lot. and this is data from 2024. So the data is pretty recent. Go ahead.
Well, and another part of that data that is surprising is that the burnout rate went up during COVID. That was pretty obvious and to be expected. And then it kind of came back down. Well, now that burnout rate is going back up, and it has now exceeded that of which it was during the height of COVID. So now physicians are more burned out as a whole than they were during the height of COVID. And when people talk about obesity is an epidemic, and this is an epidemic, physician burnout and probably professional burnout in general, not just physicians, teachers, engineers, railroad work, everyone is probably burned out. I can only speak for my own profession because that's what I've limited my expertise to. But yeah, it's hard to chew on the fact and knowing that 60% of doctors are burned out. And
Well, sorry,
it's not fun.
I think before the pandemic, we didn't really, and it wasn't talked about that much. I mean, and especially in using just the word burnout. So I think we've put more definition to the word and more context. And so naturally, too, now that we see it and we're aware of it, and I think in a good way, more practitioners are feeling more comfortable with speaking up and saying, hey, I'm feeling these symptoms, I'm feeling these emotions, I'm feeling this anxiety, depression, lack of fulfillment, all of these things. And so in some ways, I think it's a good thing that we're able to that practitioners are comfortable enough to say that they are and not feel afraid of, being removed from the job market. Because I think before the pandemic, maybe there was some of that too. Like if you took an FMLA, which is family medical leave for mental health, maybe, I mean, in some states, or I think most states, you're required to have a position when you come back. But like that dynamic could definitely shift while you're gone, depending on how long that leave is. And so I think there's definitely some context there about being willing to say, yeah, I'm not great. And yeah, this isn't what I thought it was going to be. Or like you said, like I once loved and had a lot of passion to do this, but I just don't anymore. Something has shifted and it's just not there. And having that be okay, I think that's a huge, huge thing with, like you said, everyone, but especially within the medical field, because it's like there's this expectation that if we don't show up, people die, like people don't get better, like there's definitely a high consequence when practitioners say, this is like, I've had it, like I can't do anymore, I've given my all, and I'm completely like overwhelmed and burnt out.
Yeah, and I'll speak to my own experience. You're exactly right. That was very difficult for me to come to terms with. It's almost like you're divorcing a spouse, because again, for me and for a lot of physicians and nurses, it's so much more than a job. It for me, it was my job. It was the way that I earned money to provide for my family, but it was also where I got 98% of my fulfillment in life. And especially with the cancer survival guilt that I've dealt with, I felt like I owed it to humanity and to the world to help people because, I was one of two people that was chosen to survive this cancer treatment back in the day. And so to come to terms and to admit to myself and others that I don't want to do this anymore, there was a lot of guilt. That was tough. That was tough. And so I can imagine that every physician is in a similar boat. And so that's difficult. A second reason why, an impediment is that doctors aren't real big on asking for help, and that might sound like a stereotype, and perhaps it is, but I believe it to be true. Doctors just do not want to ask for help. They don't want to admit to themselves, let alone other people, that they can't do everything, and then they can't do it well at that. And then a third reason, which is limited, I think, to the healthcare field, is the fear that they're going to lose their job, that the medical board is going to find out that they're taking a leave for some sort of mental health status, and they're going to take away their job because they're going to say you're not safe to treat patients. I mean, that is not an illogical fear. That is a logical fear. There is some truth to it. It's not nearly as bad as it sounds, but it is an appropriate thing, at least to think about, if you're a physician who's burned out, who's thinking about getting treatment for it. Let's put it that way.
Yeah. I think it's also something worth mentioning too, that I've noticed, like I don't know if this is true for physicians, but like when a nurse or a pharmacist or any other type of practitioner applies for a job and you go through all the paperwork of getting onboarded, one of those things that you fill out is a statement of disability. And now it used to be a very short list or even just a one question, like, do you consider yourself and disabled in any way, shape, or form, which also means mentally, and it would just be yes or no. But now there's a list of things, and there are a myriad, actually, several different mental health challenges or diagnoses that are on that list, and as well as other physical things. And so I think it's really important to even like acknowledge that we have made some progress, because if you struggle with one of these things, whether it be ADHD is on that list, other types of mental health challenges like anxiety, like clinical anxiety and depression are on that list too, that at least I would think, and this may or may not be true, but like you have some sort of protection by accepting sort of that label. And there might be, I'm sure there is, some sort of like self-judgment if you say yes to that question. But at the same time, like if we just think about like, well, this could be my first step of actually asking for help or admitting that I struggle with this, and it's okay, because now hopefully I can gather some tools to also help myself along the way.
Yeah. And, that reminds me of, how appropriate is it for a potential employer to even ask that question?
Right, right.
I would think that would be, HIPAA and medical history privacy and stuff like that. Because what business is it of your potential future employer to know what mental health diagnoses you may or may not have? And then, like we were talking before, again, people like to talk about how much of an advocate they are for employee mental health, until they're looking at hiring someone and that they know has a history of major depression. Is that going to factor into it? I don't know. Of course, I don't know. But that fear is something that people have, and why they don't answer in the positive to that question.
Yeah, probably they just answer no, or I choose not. I decline to answer altogether, because I mean, it's totally technically none of their business.
Right. Right.
Yeah, I mean, it's so interesting too, because like the environment that I work in, and that I think a lot of the medical industry, the way their dynamic is set up is that, each person is assigned essentially a monetary value. Like, how much are we investing in you with benefits? How much are we paying you for your salary? How much are you costing us when you use these benefits, and or you call out for sickness, for, like childcare, whatever it is. And so they have these staffing models, and they might say they're quote unquote fully staffed, but you have one person call out and then someone else has to step up and work OT. Well, and if you have that enough, then you have some people working, like double their expected allotment on a regular basis sometimes. And so it also comes as, it's like this, it's, medicine is a business, unfortunately. But there still has to be, something has to give. So where do you think we're making progress? And do you think like maybe that some of these companies, like healthcare companies, should actually infuse this coaching into their benefits package? I think that would be great. Maybe I'm on the sunny side of life here, but
yes, I think it is improving. I think, when mental health awareness and the whole wellness shift, cultural shift, if you will, when that started to become a priority, and I don't know if this is correct, but it seems like within the last 10 to 12 years, that's become a priority just in Western culture. It has slowly started to creep into medical training. And so that's where I think we're going to see the beginnings of the shift, which is the training of residents. And so the ACGME, which is the head of training for all residents throughout the United States, I'm looking into whether they are going to, within the next 3 to 5 years, require institutions to have a protocol to both diagnose mental health concerns and then to treat these mental health concerns of surgical and medical residents. And the reason I'm involved in that is because I would be involved as a coach, not as the only treatment, but as part of the treatment protocol to treat a surgical resident who is identified as being burned out. Right. And so hopefully if that starts in residency, it will both discover burnout and teach people that it's okay to admit that because it's a reality. Any doctor is going to experience burnout at some point in their career. And so if you let it go too long, it starts to affect your personal life. It starts to affect your work as a physician and as a surgeon. And at the end, your patients start to suffer. So that's the last thing that we want to see.
Right. So I always like to leave my listeners with some tools in their toolbox. So where do you think we should start? Do you think we should start with, maybe we can do like an identification, like how to identify or to know if maybe you're working through burnout or suffering through burnout, and then we can talk about some action steps to help too?
Sure. So, instead of just listing the symptoms of burnout, I will say this. There are a couple of things that you can ask yourself that will tell you if you're burned out. One is if you used to enjoy your job and you don't enjoy your job anymore, that's a sign of burnout. If you start looking at the clock at the second you come back from lunch and counting down the minutes and hours till you get to leave work, that's going to be a sign of burnout. And in general, there's an irritability that creeps in that is there all the time as burnout gets worse. So you're irritable all the time. You become angry and frustrated more often. And when those specific negative symptoms start to leak into your personal life, you're well into burnout at that point. So grumpy old man, grumpy old woman syndrome, that's what burnout looks like.
Mm-hmm. And so then what do we do?
Yeah, that's a good question. So, I would say make an appointment with your primary care doctor and then tell them that you think you're burned out at work and that you may or may not have depression and some anxiety, and then they can refer you to psychologists or psychiatrists for testing. But coaching is going to be and will remain really an important tool. And I can speak on this from a physician standpoint because, and again, it sounds like a stereotype, but I'll believe it to be true. Doctors aren't going to go to a psychiatrist to be treated for burnout. We do not like to ask for help. We especially don't want to ask for help from a colleague to treat our depression. It's just not going to happen. But for some reason, we don't mind seeing a coach, and it isn't just semantics. I mean, my responsibility as a coach is different from a counselor or a psychiatrist, for sure. But for some reason, people feel like they can see a coach. It's almost kind of like the thing to do these days is, I have a life coach, or I have a leadership coach, or a well-being coach. I have a wellness coach. It's almost starting to be kind of like the cool thing, so to speak, to do. But I will say that doctors will see a coach much, much more before they see a counselor. Yeah.
Well, I think a lot of that also just has to do with the nature of the difference between therapy versus coaching. And there's, again, a myriad types of therapy out there. So it very much depends on the type of therapist you find and if you resonate with them and if you find that they're helping you or not. But I find with coaching, and this is just in my experience as well as a coach, that it's much more action oriented. And I think, again, being in that achieving mindset, that practitioners are naturally in, like, okay, they're like, all right, then I have an action plan. There's things I can do. It's more empowering maybe than just your typical, what you might think of as like talk therapy. So yeah, but they can also be married together too. So it doesn't have to be one or the other. You can definitely have a fantastic therapist and a fantastic coach.
Yeah. And I totally agree with you. I had not thought of it in quite those terms, but I totally agree that coaching is more empowering.
Mm-hmm.
And everyone likes to feel empowered,
Yeah. Well, and especially like in this context of burnout, where you're starting to question your path, you question your choices. How did I get here? I used to love this. What happened? Again, most people go into the medical field in general as a calling more than just a job. And so when those things start to dissolve and fall apart, then it can really be, a what do they call that? A crisis of conscience, I think, or,
Yeah.
sort of a dark night of the soul period too. So,
like a full-blown existential crisis.
Yeah.
And a lot of people and a lot of physicians are surprised to learn that it's not the circumstances that are causing the symptoms of burnout. It's your thoughts, and your feelings and your emotions that stem from circumstances that cause all these negative emotions. And so, especially the cynical ones are like, I'm not going to see anything for burnout. What are they going to do? They're not going to allow me to work less, or they're not going to decrease the patient load, and which is all true, but none of that has to be done to treat your burnout is the point, Right. A lot of people are surprised to learn that. And and that is empowering in and of itself.
Right. Yes, absolutely. So where can people find you? I mentioned your website earlier, but let's just talk about your work and where people can find you to get help.
Sure. So it's exclusively done via Zoom. So anywhere in the world, I can treat someone for burnout. My website is theburnoutdoc.com. And I have got a Facebook and an Instagram and a LinkedIn and a YouTube channel that's kind of in its infancy, but we'll see where that goes. But yeah, theburnoutdoc.com is my website. There's a easy place for you to email me and we can get started.
Beautiful. Any closing words before we wrap up?
Yeah, I will give a statement from recovery for anyone who's having a hard time or a dark day or a rough spot. When I was in recovery, and there were a lot of dark days, someone told me to just make sure you do the next right thing. Do the next right thing. Sometimes that's to get out of bed and take a shower. So that's my piece of advice for today.
I love that, because it's just one small step too. So hopefully that will come across as something singular to focus on,
Yep.
So beautiful. Thank you so much. I really appreciate your time and all the work you're doing in the world. And so everybody definitely check out theburnoutdoc.com. And this episode will live on the show notes page at drlaramay.com/podcasts. So thank you very much. And we will see you in the next episode. Thank you for joining me on Light Body Radio, where functional medicine meets intuitive healing and transformation happens on every level. If this episode resonated with you, please like, share, and if you're ready to go deeper, visit drlaramay.com to book a functional medicine consultation or an intuitive healing session. Whether you need to rebalance your body, clear your energetic blocks, or reconnect with your soul's purpose, I've got you. You can also follow me on Instagram or TikTok at Dr. Lara May for daily inspiration, energy updates, and healing tools. Remember, your healing is multidimensional, and so are you. Until next time, honor your body, trust your intuition, and activate your light.